Hi, I'm Dr. White with Highland Park Animal Hospital, and I'm going to talk to you about dental procedures on cats and dogs today. So, main reasons why you would think about this might need to be done would be if you notice an odor coming from your pet's mouth, if they seem very head shy or they don't want you to touch near their face or mouth, would be our most common reasons that we'd notice. We also might just notice it during their regular wellness exam, or if we're doing an exam and you notice a swelling on the face. All of those reasons might prompt us to say, hey, it's time to clean your pet's teeth. When we do this procedure, we're going to do it under anesthesia. The main reason for that is honestly, many times it's painful for our pets because if they have dental disease, it's uncomfortable. If you've ever had your teeth cleaned when you maybe waited a little too long to go to the dentist, you can probably attest that it's not the most pleasant experience, and even more so for our pets. Our other reason is that we can only get dental x-rays when we're under anesthesia, and those are extra important for our dogs and cats because their roots are way bigger than our human roots are, because they're going to grab and hold things as opposed to us where we just grind. So their roots are a big part of their dental health and how we decide whether a tooth can stay or go. Overall, if we're going to go through the day of what happens, you're going to drop your pet off first thing in the morning after not having any breakfast. We're going to do some blood work to make sure it's safe to put them under anesthesia and have an IV catheter put in. Then we're going to fully put your pet under anesthesia, put an endotracheal tube in, make sure we're protecting their airway and that no water from the cleaning is going to get down in their lungs. Then we're going to scale, polish, and x-ray all under anesthesia. Based on those x-rays and our exam, we might decide, wow, there's a lot of bone loss or there's an abscess. This tooth probably should be surgically removed. And based on that, we'll do that procedure. Many of our pets, we're just going to clean, scale, get these x-rays, and they're good to go home that evening. If we end up having to take out some teeth, it's going to be a little bit longer under anesthesia, and there's going to be more aftercare. But either way, they're going to be much more comfortable when they wake up than they were when they went under anesthesia before we clean their teeth. It's also incredibly important for their overall health. We've shown on average pets who have regular dental care live 2 years longer than pets who don't have any kind of regular dental care, which makes a lot of sense if you think about it. If we have this mouth full of bacteria and we're just showering our bloodstream, our kidneys, our heart, and all of these vital organs with gross bacteria from our mouth, that makes a lot of sense why those pets aren't going to live as long and their organs aren't going to function as well. So it's even more important that we think about that when we think about our overall pet's health. So that's what we're going to do on a day with the dental. And if you have any questions or you want to know if maybe your pet's oral health needs to be addressed, I'd recommend scheduling an exam, because that's how we will find out.